Summarize in 42 words. Today's lecture will cover radiological evaluation of liver conditions. We will discuss CT and MRI techniques, as well as other imaging modalities and procedures used. Topics include autoimmune hepatitis, Fibril lamellar hepatocellular carcinoma, and hepatic cirrhosis. Let's begin our journey into hepatic radiology. To start with, hepatic steatosis is the accumulation of excess fat in liver cells, which can occur due to various causes including alcohol consumption, obesity, or metabolic disorders. CT and MRI are widely used imaging modalities for assessing hepatic steatosis. CT can provide detailed cross-sectional images of the liver and quantify fat content using Hounsfield unit measurements. MRI, on the other hand, offers superior soft tissue contrast and can further characterize the distribution and severity of fat deposition using specialized sequences like Dixon imaging. These imaging techniques play a crucial role in diagnosing and monitoring hepatic steatosis. Nodular regenerative hyperplasia, NRH, is a relatively rare liver condition characterized by diffuse hepatocyte nodularity without fibrosis or cirrhosis. CT and MRI can help evaluate NRH by demonstrating the presence of multiple small hypodense/hyperintense nodules scattered throughout the liver parenchyma. Imaging findings might be subtle and easily missed, necessitating a high index of suspicion for accurate diagnosis. Furthermore, these imaging modalities can assist in the differentiation of NRH from other liver lesions such as metastases or hepatocellular carcinoma. CEIS is a valuable imaging technique for the assessment of liver fibrosis. It involves the injection of microbubble contrast agents, which provide real-time vascular imaging. In liver fibrosis, the deposition of fibrotic tissue disrupts the normal vasculature, leading to characteristic patterns on CEIS. These patterns can be used to stage the severity of liver fibrosis, guiding treatment decisions and monitoring disease progression. CEIS also offers advantages over other imaging modalities, such as lack of ionizing radiation and the ability to assess hepatic perfusion dynamics. Portal hypertension is a significant complication of chronic liver diseases that leads to various clinical manifestations. DWI is an MRI technique that quantifies the random motion of water molecules within tissues. In portal hypertension, DWI can assess liver stiffness by quantifying the apparent diffusion coefficient, ADC, values. Decreased ADC values correlate with increased fibrosis and portal hypertension. DWI can also aid in the identification of complications like portosystemic shunting and the evaluation of response to treatment. Hepatocellular carcinoma, HCC, is the most common primary liver malignancy. DCE-MRI is a technique that tracks the uptake and washout of contrast agents in liver lesions over time. This allows for the characterization of HCCs based on their enhancement patterns. DCE-MRI can aid in differentiating malignant from benign liver lesions and guide treatment strategies, including surgical resection, ablation, or transplantation. TIPS placement is a procedure performed to alleviate complications of portal hypertension. It involves creating a shunt between the portal vein and hepatic vein to divert blood flow and reduce pressure within the portal system. Radiologists play a crucial role in TIPS placement by performing image-guided procedures such as fluoroscopy, ultrasound, or CT/MRI. These imaging modalities help guide the placement of TIPS and ensure optimal shunt function and patient safety. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by immune-mediated hepatocellular injury. CT and MRI can aid in the evaluation of autoimmune hepatitis by demonstrating characteristic imaging findings such as hepatomegaly, paraportal or interface hepatitis, and parenchymal enhancement. These imaging modalities also help exclude other causes of liver disease and assess the extent of fibrosis or cirrhosis. Hepatic arterial infusion pump therapy is a specialized treatment option for selected patients with liver metastases. The pump delivers chemotherapy directly to the hepatic arteries, maximizing drug efficacy while minimizing systemic side effects. Radiological evaluation plays a crucial role in the monitoring of hepatic arterial infusion pump therapy by assessing pump function, catheter position, and treatment response. CT or MRI can be used to assess changes in tumor size, perfusion, and response to treatment. Fibril lamellar hepatocellular carcinoma, FLHCC, is a rare variant of HCC that often affects young individuals without underlying liver disease. On imaging, FLHCC typically presents as a large, heterogeneous mass with characteristic fibrous septa and absence of significant liver cirrhosis. CT and MRI can aid in the detection and characterization of FLHCC, guiding treatment decisions and prognosticating patient outcomes. Hepatopulmonary syndrome, HPS, is a pulmonary vascular complication of liver disease characterized by ventilation-perfusion mismatch and arterial hypoxemia. CT arteriography and perfusion scintigraphy are imaging techniques used to evaluate HPS. They can demonstrate abnormal pulmonary vasculature, including intrapulmonary shunting and dilated arteriovenous connections, helping to confirm the diagnosis and assess disease severity. Hepatic encephalopathy, HE, is a neurological disorder that occurs due to impaired liver function. CT and MRI play a crucial role in the radiological assessment of HE by excluding other causes of altered mental status and ruling out structural brain abnormalities. Furthermore, advanced imaging techniques such as MR spectroscopy and functional MRI can provide insights into the metabolic and functional changes associated with HE. Hepatic cirrhosis is an irreversible condition characterized by progressive fibrosis and distortion of the normal liver architecture. Radiological grading of cirrhosis involves the assessment of liver morphology, including the presence of parenchymal nodularity, presence of ascites or varices, and changes in liver vascularity. CT and MRI play a critical role in grading the severity of cirrhosis, aiding in prognosis determination and treatment planning. In conclusion, radiological evaluation is crucial for diagnosing and treating liver diseases. This video covered various imaging techniques and their role in assessing conditions like fatty liver, liver fibrosis, and liver cancer. As radiologists, we must stay up to date to provide the best care and improve patient outcomes. Thank you and see you next time.